Hello, everyone. This is Erika Hood with the Center for Reducing Health Disparities, and I'm here with another one of our wonderful COVID-19 community spotlights, and we're here with Elaine Tso with Asian Services in Action, and I just want to welcome you today. Thanks for joining me.
Thanks, Erika. So glad to be here.
No problem, no problem. So can you give our listeners just a brief introduction about yourself and your organization?
Yes, so I'm Elaine Tso. I am the relatively new CEO of Asian Services in Action. I came into this role in May of 2019, and then quickly, 9 months later, we were in the middle of a pandemic, and that's where we've been ever since. The organization, it's an organization that supports AAPIs, Asian American Pacific Islanders, and immigrants and refugees.
Awesome, thank you. And we said you came in and just 9 months later, there was the pandemic, and here we reside within the pandemic still. It's crazy how much time has flown by, and we're still here. So hopefully we'll see a shift next year. Awesome. How about your organization's internal response to COVID-19? So here you are, a new ED, and this huge global pandemic comes. What did that look like during the early month of March of 2020?
I mean, we had to rapidly respond to this sudden increase in demand for everything. I mean, the community needed information in language, and we had to make sure that the information that was being broadcast to the vulnerable immigrant and refugee, limited English proficient community was accurate, and that it had been vetted, and just making sure that people weren't following the various misinformation that was put out there.
So was that your original, the first line of business was to make sure that information in the appropriate languages was disseminated to your constituents? Is that what you guys kind of did first?
Yeah, so our team, our bilingual team immediately got on the phone to check in with each of our clients and patients just to make sure that they knew what was going on, that we were going to remain open, but the delivery of services was going to be shifted. We no longer were able to accommodate walk-ins the same way that we were able to in the past, and we just had to adjust, to the reducing the number of people that were in any given space for physical social distancing safety. We had to institute, mask wearing protocols, and for the community health center arm of our organization, we launched telehealth for the first time.
So let me take a step back. In pre-pandemic, what did a typical week look like for you all as far as the service, or a day? What did that look like as far as the services that you all provided before the pandemic, so we can see what that shift was like?
Yeah, so the community that we serve, they are, 80% of the community that we serve is limited English proficient. And that means not only that they have challenges with the English language spoken word, but also in terms of literacy. They often receive documents that they cannot read. And then added on another layer to that, some community members have low literacy in any language, because some of the community members that we're serving come from countries where there was ethnic cleansing involved. So they were not even allowed to learn the language of their own culture. So they can only speak the language, but not read or write it. And so translation wasn't always the solution. We had to connect with the community either in person to demonstrate what the information that they were receiving contained, or we had to speak to them on the telephone, things like that. The majority of the community, even before the pandemic, was digitally disconnected. So when things went virtual during the pandemic, it was an ongoing barrier for the things that the community needed.
Every time I talk to you, I learn something new with the ethnic cleansing and like these different layers and the challenges that come with the work that you all do. So just thank you for sharing. I'm always learning so much from you. And it's just great. So engagement during early pandemic, you said sometimes would be face-to-face in order to demonstrate things and show. How was your staff during that time? I mean, we all had fears and there was this huge unknown. So what did that look like for the staff to then say, you know, we have to do a job to help serve, you know, our community members?
Yeah, so the staff has been really the unsung heroes of this time. You know, we all faced challenges during the pandemic, and you know, our staff was not immune to that. So they had their childcare issues, the school closings, the you know, all these different changes that were happening during the pandemic, and yet they you know, had such a drive to support the community that despite all their own individual personal challenges, they still delivered the services that we deliver. So there were increased demands for food and supplies and things like that during the pandemic. So we continued to distribute food, but we had to deliver it in a different way. In the past, community members would come to our locations and obtain food from our food pantries. But during the pandemic, we had to deliver the food to the community members because of the restrictions around the number of people that could come into the building. And so that was like an added set of requirements for our team members. And they, you know, like I said, were amazing during this time and continued to make sure that everybody got the food that they needed, and also the PPE, personal protective equipment, because some community members, they did not understand, like, okay, where do I get a mask? You know, do we make masks? And so we were distributing those supplies as well.
Did you see any partnerships that you may not have had prior to COVID? Any unique partnerships that may have come together during this time because of additional resources and support?
Yeah, something that was really, really remarkable, and I am so proud of the federally qualified health center system. You know, all of the FQHCs, I mean, they were such fantastic partners in ways that we, I guess, didn't necessarily feel like we had to lean on each other pre-pandemic, but during the pandemic, we really leaned on each other a lot. You know, whether that was because, you know, some of us had lots of PPE and others of us, you know, were, you know, short on PPE. We made sure that we had each other's, you know, support to get what we needed during the pandemic. Additionally, there was a lot of coordination around testing, vaccination. You know, we really kept each other informed. As soon as we learned something that maybe our other FQHC partners did not know, we shared it. We met on, and we're still meeting on a regular basis to keep each other updated on any new information that we have. And we've also been just helping each other out. You know, when one of the FQHCs held a mass vaccination event, you know, some of our team members showed up to support. We also collaborated with the greater Cleveland congregation to also ensure that community members felt like they were in a safe space to get vaccinated. There's so much historical, you know, so many historical issues around vaccination and, you know, just the medical intersection with communities of color. And so we were so proud to be part of the Greater Cleveland congregation and their mass vaccination events that, and also United Healthcare came together with us to not only provide testing, vaccination, but also food. So at one of these collaborative events that we held, with the other FQHCs, community members would either get tested or vaccinated, and they also got a box of food. So it was really a fantastic partnership that I'm so proud we were able to be part of.
That's awesome. And I always ask organizations, what has stuck that, some tweaks and changes that you had to make to program delivery or how you communicate with your, community members? What has stuck? What has been some of those things where you're like, why didn't we do this before?
Yeah, I mean, so one of the programming pieces that we have always had is a congregate meal program that we had for the elders in the community. So they would meet every other week to socialize and have a lunch together. And at this, during the pandemic, there were lots and lots of food preparation or restaurant closures because of just the impact of COVID on public gatherings. And so we've been partnering with different restaurant or food prepared businesses to provide meals, like hot meals to deliver to homes. And I don't know why we didn't engage more intentionally in that way before the pandemic, but now we're kind of spreading the love or sharing the love in terms of investing in some of our small business partners to prepare the food that will get delivered to the community members, that even though they can't gather together in person, they are able to still get food. And we've had a pilot program to teach the elderly community who have access to either a smartphone or we've also partnered with the Direction Home aging program. They were able to provide us with some laptops for community members that were interested in learning how to use Zoom. And so even though in the past, community members were I guess preferring to be in person, and I personally would prefer to be in person as well to connect with people. But when you can't meet in person, Zoom is the next alternative, I guess, and that applies the same way for the aging community. And so we were teaching some of the elders in the community how to use Zoom, and then also partnering with small businesses that prepare food to deliver the food to them, and then they would still share the meal together, but it would be shared over Zoom.
I love that. That is such a cool idea. And that's a lot of what, folks did across the board, so it makes sense to add that component for a programming component for the organization as well. It's just a great idea to help with that social connectedness that we were all missing out on. So yeah, it's a great idea. So I know that the pandemic has been tough for all of us, especially tough for the AAPI community. How do residents feel now? Like, it's 2021, we're approaching the end of the year. What is kind of your feel or take on how folks are doing now with your programming and just overall feelings within this pandemic?
Yeah, so the pandemic has been this very complicated experience because there's been the health, the public health crisis of the pandemic itself, but there was also during the pandemic this kind of racism as a public health crisis as well, and the communities of color, including the Asian community, has felt kind of the impact of that. And for the elderly female community, they have been the primary target of some of the anti-Asian hostilities that have been brought on the community. And again, none of this is new. Really, any community that is vulnerable is going to be subject to these kinds of situations. And throughout history, communities of color have been marginalized and, sometimes taken advantage of, sometimes pitted against each other. And in the current time, the community has faced an increase in racism, just around kind of a false narrative that the Asian community is somehow responsible for COVID-19. And I'm sure people have already seen like the medical evidence about all of us are in terms of DNA, we're all the same as humans. So it's not like my DNA is different than your DNA to be more likely to spread a virus or something like that. But that was the unfortunate narrative coming from people that wish harm upon communities of color. So that has been an added challenge during the pandemic, to have to fight this other battle on a different front, where the community did not feel safe, not only to go out because of the virus, but also not feeling safe to go out because there were people that were intentionally shoving, elderly females, who typically in the past, the Asians that live in Asiatown, they like to walk around the neighborhood, and they felt unsafe to walk in their own neighborhoods because of the things that were happening.
Okay, thank you for sharing that, because I know that was a huge a point of, I think, it brings to light just the differences in people in our country. We have a wonderfully diverse country, but again, the negative impacts that often hit people of color throughout history, just like you said, this is one of those really crucial and critical moments when it comes to a global pandemic. And I know that it weighed heavy on my heart to think about, just what folks had to deal with, especially here in Cleveland, So thank you for sharing that. And then I'll put you on the spot with two more questions, one of them being volunteer opportunities. For folks who are watching this now, it's the holidays, it's a season of giving, and many folks are looking for ways to help and give back. So what would you say can be some opportunities for folks to connect and help out Aging?
Yeah, so there's a couple of ways that people can help out. Of course, if someone wishes to give their time, we would welcome volunteers who can help us with a whole variety of things. And I don't know if the people that are watching this would be aware. I mean, I had a conversation with someone yesterday that they referred to the Afghan community as Central Asian. And in my mind, I said, oh, well, that's an interesting way to characterize the Afghan community as Central Asian, but I just refer to them as Asian, and it may be news or information to some of the people that are watching this, that Afghanistan, or people from Afghanistan, are considered Asian. And we have been helping that community as they are dealing with the fallout in their country, with the change in government over there. And what we are planning for the end of the year is to provide some welcome packages to the new arrivals that we're expecting for the rest of this year, and then into the new year. I mean, overall, we're expecting, over the next, approximately 9 months, over 1,000 new arrivals coming to Northeast Ohio, and they need everything because they are coming, without hardly anything, and they definitely are coming to a space where outdoors is very different here than it is over there. They come from a warm weather climate. We here are, bundling up, and some of us love it with being able to layer up. I'm one of those. Mm-hmm. But that means that they don't have coats, they don't have like winter clothes, hats, gloves, etc. And we are always looking for people who are willing to help us, like sort donations and things like that, provide donations of those physical items. the community needs dishes and like kitchen supplies, things of that nature. And again, all that stuff needs to be sorted, distributed, and volunteers would always be welcome to help us with that. And then if someone, you know, is not able to give up their time, but they have some treasure that they would like to share with us, we accept donations of monetary donations, and they can do that through Asia's website, which is asiaohio.org. And there's a donate button on the main page that they can make a financial donation. And then additionally, if somebody wishes to share their talent, we have a refugee youth mentorship program that is always looking for, you know, people of a variety of professional experiences, who would be willing to mentor someone who's new to this country. You know, the youth that we reference are people who are aged 16 to 25. And when you are a newer, you know, someone who's new to this country, you don't have the same type of, you know, network that someone who has been living here for a very long time has. It's not like, you know, someone could say, oh yeah, I want to become a dentist or whatever. I want to become a dentist. I'll just ask my dad's friend. He's a dentist. You know, it's not that way. For the newly arrived community, they don't have those types of networks. And if there is someone who is willing to provide professional mentorship, or even to introduce our refugee youth to career opportunities that they might not have even thought of, because they might not have existed in their country of origin, those individuals are very welcome to contact us through email at info@asiaohio.org. If they send an email to that email address, we can follow up with them. There's also a button on our website. I think it's called, it's either volunteer or that's another way that they can get to the info@asiaohio.org email. But they can also do it directly. Just send an email to info@asiaohio.org.
This is great. I mean, I think these are wonderful opportunities, and we would definitely share them. The center, we would like to post some opportunities from our community partners and ways that folks who will read our newsletters or visit our website or social media pages can give during the season. So I think that these are wonderful opportunities, and I'll make sure to post those as well. And then the last question would be, what would be a message to share with your community members? I ask folks to often send a message early on. You can imagine some of those messages were just words of encouragement and, you know, we're here for you, things like that. You know, this was like April, May of 2020. But yeah, I would ask that you share a message to the folks that you serve and just leave them with a word or two.
Yeah, that's a hard, prompt there. But I mean, I would just say, you know, that going into the new year, I mean, I always look at the new year. You know, you don't just turn the page on the calendar, but it's also like a kind of a fresh start in a lot of ways. You know, that if you turn the page on the calendar, and it's with hope, you know, because it is a blank page. You know, we can shape our future. And I guess I would ask any community members that are thinking about how we're going to go into 2022, that they think about, you know, what would you do if we could all be together again in the same way that we were before the pandemic? I mean, I would definitely cherish the people that are around me much more, because who knew that I would be kind of separated from some of the people that I value so much. And I would also encourage people that if they're not vaccinated, that now is the time. You can still get vaccinated. We offer vaccinations at both of our community health centers, and all you have to do is call our sites and you can get vaccinated. And then also the vaccines are now available for children ages 5 to 11. So protect your children, protect your family, get vaccinated.
I think That was a great message, a message of hope, a message of being intentional with loved ones. And then also let's, try to put this pandemic behind us by, making choices to keep our family safe. So thank you. I think that was great. Thank you so, so much. It was great talking to you today. And I appreciate the message. And I look forward to seeing the wonderful work that you all do.
Thank you so much, Erika.